Hi friends, this is Dr.Vinayak Rengan, general surgeon, laparoscopic surgeon, and I'm going to be a mentor in the Mortimer Green MRCS Part B course. So today we're going to be talking about what is MRCS Part B and what is the structure of the MRCS Part B examination. MRCS Part B is the final step towards your GMC registration, and it is the entrance to a surgical training pathway in the UK. Of course, you have to understand that MRCS is not the equivalent of an Indian MS or anything. It's a completely different pathway, but it does definitely make sure that you are eligible to start your advanced surgical training in the UK. So the MRCS is basically an OSCE examination, objective structured clinical examination, and there are 17 stations in it, and they are split into two rounds. One is the skills round, and another one is the knowledge round. And there are three anatomy stations, two pathology stations, three critical care, three examination, two history taking, two communication, and two procedures. The two communication stations also are preceded by something called as a rest station, where you're allowed to prepare for the communication stations. So each of these stations lasts for 10 minutes. There is 1 minute given for reading the stem, which tells you what you're going to anticipate in the station, and there is 9 minutes for the station. In certain stations, the 9 minutes is split into 6 and 3. In 6 minutes, you do the actual work in the station, and 3 minutes you answer the questions. Timing is a very important part of your MRCS Part B examination. However, it's very important to understand that candidates outside of UK find this examination a little tough because they are unused to a lot of protocols in the NHS and how things function in the UK. One of the key challenges for a non-UK and international candidate is communication history taking. There are certain people called the lay examiners who assess you on how you behave with the patients, how you behave to the examiners, and that is something which kind of is lacking in our South Asian curriculum. And so this is something which we concentrate on a very high basis on our MRCS Part B course, which we conduct regularly in Delhi and Chennai. We have conducted 6 courses as of now, and we do have an excellent pass percentage. Our focus is on improving soft skills, improving body language, improving communication, asking the right questions in history taking, performing the examination the right way. We go into minutiae. We concentrate on simple things as like how you lean your body, how to how not to spread your legs, how to dress, and these are all very important parts of your examination, and this is all something which we concentrate. We also will be touching on the knowledge aspects of it. Of course, you will be expected to read anatomy and pathology on your own for the examination, but I can assure you one thing: you will be taught critical care, you will be taught the secret patients, you will be taught examination very well on real patients. You will be taught how to do procedures on mannequins. We will be teaching you the right way to suture. We will be teaching you the right way to put a knot deep inside the abdomen. We will be teaching you how to catheterize a patient, how to do an IV line. And this will be on simulated models, just like how it is in your MRCS Part B examination. All communication and all history taking stations will be simulated in your MRCS Part B weekend course. And we are planning to conduct the next course sometime in December of 2022. But we conduct these courses regularly, and we'll be glad to have you in our course. So if you're interested, do contact our team, and we'll let you know the dates for our next course. These courses are quite popular, so they sell out. So do contact our team soon. If you have any doubts regarding MRCS Part B examination or a career in the UK, don't hesitate to contact the team. You can email us, or even best, you can put those comments, put your doubts out in the comments, and we'll be glad to answer them. Thank you so much.